Hello, and thank you very much for joining the New England Baptist Hospital webinar series. We're very happy to have you here today. As most of you know, we are a specialty hospital and the only one in New England that works exclusively in orthopedic care. We see the largest volume of orthopedic cases in the area, and we have achieved a unique level of expertise, not only seen at the surgeon level, but also from all the medical staff that is involved in caring for our patients. This knowledge and expertise is what we would like to share with you through our webinar talk today, because we believe that education and knowledge will empower you as a patient to make the best decision relative to your health. We hope you find this webinar helpful, and we thank you very much for watching.
I'm Dr. Jim Nairus. I'm one of the orthopedic surgeons at New England Baptist Hospital. I concentrate, at least in my practice, on mainly hip and knee surgery. I'm going to go over today with you essentially what to expect after hip replacement surgery. I'm going to try and answer a lot of the questions that come up with patients, both before and after hip replacement surgery, and hopefully answer most of those common questions for you today. So just one of the very common questions that comes up before somebody considers a hip replacement is, when should I consider having a hip replacement? So essentially, a hip replacement surgery is an elective surgery. It's not a cosmetic surgery, so insurance companies cover it. But everyone has different degrees of arthritis, and everyone has different pain tolerances to the symptoms that come from the hip arthritis. So in my opinion, an individual should consider having a hip replacement when their pain, which is from the hip arthritis, is usually in the groin, sometimes in the anterior thigh, when it becomes debilitating for you and is affecting your life. I think there's essentially three questions that you can ask yourself, and if any one of these three questions are positive or to the affirmative, I think those are a lot of times an indication that you should have a hip or consider having a hip replacement surgery. So first of all, if it starts waking you up or keeping you up at night, that usually starts affecting your life, affects your day, and that's usually a sign that you need or would benefit from a hip replacement. And then if you start kind of waking you up in the morning and you have to plan your day around how you think your hip's going to feel, that's another indication. And then if you start avoiding the activities in your life that you like to do because of how your hip feels, so any of those affirmative answers, I think, are indications that you should consider having a hip replacement. So another common question, how long will I be out of work after hip replacement? From what I do, hip and knee replacements, the hip replacement is a much easier recovery than a knee replacement. The time people take out of work usually ranges anywhere from 2 to 4 weeks after surgery up until about 10 to 12 weeks after surgery. And this essentially depends on your recovery, but especially based on the occupation and the type of work that you do. But I always tell my patients that if you have to tell your workplace how long you're going to be out of work, I would kind of use a longer estimate if you're not sure, just because it's easier to tell your employer a certain time, and then if you want to come back sooner than that, it's easier to come back sooner versus if you tell them a certain amount of time, then have to come back later. It usually involves a lot more paperwork, a little more question about when or if you want to go back to work. So I would definitely give a longer estimate if anything. So a lot of people ask, how much pain will I have after surgery? In the recovery process after hip replacement, I think most of the pain is actually in the first just 1 to 2 days after surgery, and these are usually mostly in the hospital. Unfortunately, the pain gets better very quickly after that. We've determined here at New England Baptist Hospital, and there's several studies to support this now, that earlier mobilization after hip replacement surgery tends to make you feel better quicker and recover quicker. So that's why we try to get most of our patients that have a hip replacement up with physical therapy the same day of surgery. And then as far as how long you have to take narcotics for, most of the time people take narcotics anywhere from 1 to 4 weeks after surgery. But the key thing in this aspect of it is that everyone is different. Everyone responds to the hip replacement different. Everyone has a different pain tolerance, so you really can't compare yourself specifically to everybody. So next question, we oftentimes get asked, what activities will I be able to do after I recover from a hip replacement? as opposed to knee replacements. Knee replacements don't always feel to the patient like their normal knee. However, hip replacement feels like a normal hip. As long as you don't get a big leg length discrepancy after the surgery, patients a lot of times don't even notice that they have a hip replacement in. So, but from an activity restriction afterwards, most of us tell our patients that it's fine to do occasional high-impact activities such as running or jumping, but you probably should avoid repetitive high-impact activities such as running or jumping. So what I always tell my patients is that, if you want to play basketball or volleyball or something like that, or with your kids, occasionally, things like that, I think it's fine. But to actually join like a soccer league or a basketball league, I think that's a mistake, because essentially you just have to realize that how long your hip replacement lasts essentially depends on what you do to it. So the next question that's oftentimes asked by patients is, what should I do prior to my hip replacement? So once you've decided you want to have a hip replacement done, you've scheduled the surgery, what should you do from that time up until when you have the surgery? In my opinion, stay as active as you can. And then the most important thing, I think, is to try and maintain your strength and your range of motion as best as you can, because this will help your recovery. Obviously, the less muscle atrophy that you have before the surgery, the quicker you'll get your strength back after surgery. And also with arthritis, with time, as the arthritis gets worse, typically you lose more motion, your hip gets stiffer. That's one of the things that you kind of wait after surgery to get your motion completely back afterwards. And then as long as you try and maintain that as best as you can before surgery, the recovery becomes a little bit easier. Other important things are that most of us recommend that patients not have any dental work, especially elective dental work, for approximately 3 months after the surgery, because it puts you at an increased risk of having an infection. So because of this, you should really make sure that all dental work is taken care of prior to your surgery. Also, many patients are on anti-inflammatory medications after surgery or prior to surgery for their arthritis, and most of these anti-inflammatory medications can cause increased bleeding with your surgery. So we ask you to stop most of these anti-inflammatory medications for a week prior to surgery. Now that causes some people to have increased pain in that week prior, and one thing that you can take as a substitute is Celebrex. So Celebrex is the one anti-inflammatory medication that does not cause increased bleeding, and that's why most of us at the Baptist usually even prescribe this prior to surgery, and for you to take after surgery, but you can also take it for the week leading up to surgery as well. So the hip replacement essentially is made up of two major parts that are shown in this diagram. There's an acetabular component, which is in the pelvis part of the hip, and then there's a femoral component that is the femoral stem that goes down the shafts of the femur. And then the bearing surface is essentially a ball that sits on the femoral shaft of the prosthesis that rubs against the liner that sits in the acetabular component. And then there's different types of bearing surfaces. Essentially nobody uses, or it's very uncommon to use cement anymore in fixing these the hip replacements. But the bearing surface, I would say most commonly, is a plastic liner that sits in the acetabular shell, and then there's either a cobalt chromium metal ball or a ceramic ball that rubs against that plastic liner. You can also have a ceramic liner as well that's just not used quite as commonly. So another major significant or common question that we have prior to surgery is, what is my incision going to look like? Everyone wants to know how long their incision is going to be, where it's going to be, and this really varies a lot. So you should ask your individual surgeon that. But essentially, nowadays there's essentially three types of incisions that are used. There's the posterior incision, which is the one toward the person's butt in this diagram. There's a lateral approach, which is the one directly on the side, and then there's a anterior approach, which is in the front. And there's a lot of marketing and there's a lot of opinions of which of these surgical approaches is better, but the location of your incision will depend on where your surgeon is most comfortable with. And then as far as the length of the incision, that also varies by the surgeon. Essentially, it's the standard in orthopedic practice that the orthopedic surgeon needs to make an incision the length that will allow them to visualize the hip different areas appropriately. And some surgeons need or make a bigger incision just to make sure they can visualize everything well. Other surgeons are a little more comfortable with smaller incisions. But I think the bottom line is there have been multiple studies that have shown that your function after surgery, your recovery after surgery is really not affected by the length of the incision, but cosmetically patients tend to like a smaller incision, but functionally it's not going to make a difference. The other thing I think you have to take into consideration is you can't tell every single patient how long their incision is going to be, even if you're the surgeon itself, because it's patient dependent, and I would say it's most dependent on the size of the patient or the the muscularity of the patient. Because essentially, the bigger the patient, the bigger the scar that you're going to need to do, or the bigger the incision that you're going to require to get the appropriate visualization during the surgery. So then, once you come in for your hip replacements, for the hospital stay, it varies. And again, you just have to realize everyone's different. You can't compare yourself to to everyone else. But on average, the hospital stay is usually anywhere from 1 to 3 days after surgery. And while you're in the hospital, you'll get daily physical therapy, usually twice a day. There is a risk for getting a blood clot after hip replacement surgery. So every patient is on some type of blood clot prophylaxis that starts in the hospital. This is also surgeon dependent, it's also patient dependent, depending on your risk factors for getting a blood clot afterwards. But your blood clot prophylaxis can range from just taking aspirin to Lovenox shots, or to a blood thinner like Coumadin that has to have blood work drawn to get the correct dosage of it. Most of the time, an individual can put full weight on their hip afterwards. These are, as I mentioned before, they're usually not cemented in, but they're press fit. They get a very tight fit, and as long as you don't get a fracture putting the implants in, which happens very rarely, you can put full weight on it. However, you usually need either crutches or a walker to help you for a certain period of time, which also varies depending on the patient. Normally you're on the crutches or walker on average from anywhere from 1 to 4 weeks, and then you use a cane for a short period of time until you're not limping after that. Some patients will have dislocation precautions. This also depends on the surgeon and the type of surgical approach that's used. Essentially, the dislocation precautions are usually that you just ask the patient to not bend over significantly or rotate their leg in excessively. And usually these dislocation precautions are just for about a month after surgery if you have them. So when you are discharged from the hospital is essentially dependent on your comfort combined with your medical stability, how medically stable you are, and how you're doing with physical therapy. And the last one is probably the major one. You don't get sent home from the hospital until you're cleared by physical therapy, which essentially means that the physical therapist feels that your functional status at that point is up to wherever you're going. If it's home, you have to be independent with the activities that you're going to be doing at home, which the last one probably is stair climbing. If you're going to a nursing facility or a rehab facility, this isn't quite as important, but you essentially have to clear physical therapy before you're discharged. So another common question that comes up before surgery, and sometimes you don't know the answer until after surgery, is will I go home after discharge from the hospital, or will I go to a nursing or a rehabilitation facility? And I think it's, as you see, as time goes by, more and more people, especially after hip replacements, are going home rather than to a nursing facility or rehab facility. I think a lot of this has to do with the fact that a lot of these nursing facilities and rehab facilities are not as good or do not provide services as much or as good as they used to, and that's because reimbursement rates have been cut. So we find on our satisfaction surveys, essentially that when patients go to a nursing or rehabilitation facilities, oftentimes they're disappointed because they're expecting services like they got in the hospital, and it just is not the same. The other thing that's important to note is that a lot of patients call these rehab facilities, and they're expecting what you get in what's called an acute rehab, where you do get physical therapy twice a day and you get a little more involved services. But most insurance companies don't approve individuals going to an acute rehab after a single joint replacement like a hip replacement. So you essentially usually go to a skilled nursing facility, which is kind of like a nursing home, which you don't always get physical therapy 7 days a week. Actually, you usually don't get physical therapy 7 days a week. You usually get it once a day at the most. So you just have to have realistic expectations with what you're expecting at the place you're being discharged to. So essentially, whether you go to a nursing facility or to a rehab facility after discharge from the hospital, essentially depends on how you're doing physically and how stable your medical condition is. Obviously, if you have a medical condition that has to be more closely monitored, you may have to go to one of these facilities. And also, if your activity that's determined by the physical therapist doesn't seem to be up to being independent at home, you usually need to go to one of these facilities. But essentially, we encourage people to go home if they're able to, because patients seem to be more satisfied when they go home. And the other thing that's just kind of a theoretical determination in this case is that a lot of patients at nursing facilities and rehab facilities are there with infections. So we kind of feel that when you go home, there's probably less bacteria around, and you might be slightly less at risk for getting an infection. And then if you do choose to go to a nursing facility or rehab facility, I would recommend you go to one close to home. That's another question that commonly comes up. You don't need to necessarily be close to New England Baptist Hospital or to the hospital that you're having your surgery at. I would go one close to home so that patients that are visiting you there don't have as far to go to visit you. So another common question that comes up is, what will I need at home after I have my hip replacement? So essentially, all insurance companies approve home services after you go home. This is whether you go home right after surgery, after discharge from the hospital, or after you go home from the nursing or rehabilitation facility. This usually involves a nurse that comes into your house and also a physical therapist. The insurance company usually will approve up to 4 weeks of these services because they essentially consider you homebound up until approximately 4 weeks after the surgery. They'll usually come in 3 times a week. And then another common question we get regarding this is that, does somebody have to live with me, or do I have to have somebody there 24 hours a day if I go home? And that's not necessarily. Obviously, if it's available, it's probably helpful, but you just need to have somebody that can check on you periodically. And then when you're at home, there are several devices that help you in the recovery of the hip replacement, and the hospital can get you several of these. These include a raised toilet seat, a reacher and grabber, shower chair, things like that. But these are all things that you don't have to necessarily worry about prior to surgery. They're things that we can arrange for you to get while you're in the hospital. And then the other thing is that in your house, if you're trying to get your house ready for your recovery after hip replacement, the one thing that's hard, especially initially after hip replacement, is stair climbing. So you want to get your house set up in such a way that you're not repetitively having to go up and down stairs. So you want to probably be on the floor that has a bathroom on it more commonly, and it's fine to go up or down the stairs 1 or 2 times a day. But some people decide to bring like a hospital bed or a regular bed down to their main floor, but you just should make arrangements so that you're not doing repetitive stair climbing. So another common question is, when can I drive after surgery? This also somewhat varies by the surgeon, but I would say most commonly it's anywhere between 3 to 4 weeks. If I have a very active patient and it's their left leg, their non-driving leg, I'll sometimes let them drive at 2 weeks. If it's your right leg, your driving leg, it's probably not completely safe until approximately 3 to 4 weeks after surgery. But again, that somewhat depends on how you're recovering, how quickly you're recovering after the surgery. But you also have to remember that, as I mentioned before, the insurance company will provide you home services as long as they consider you homebound. Once you start driving, you're not considered homebound anymore, so then your home services are usually cut off at that point. So how will I feel 4 weeks after my hip replacement? Most of the pain with the hip replacement goes away in the first 3 to 4 weeks after surgery. So by 4 weeks, you have minimal to no pain. Your hip usually still feels a little stiff and a little weak at that time. Some people still limp a little bit at that time. Usually there's no more dislocation precautions at that point. And then there becomes the question, then, do I still need to do physical therapy? Essentially at 4 weeks, you still need to do physical therapy exercises. With hip replacements, I don't think it's mandatory that you have to go to outpatient physical therapy at this point. Some patients feel that they benefit from it, which is fine. But if you do, I think if you are a motivated person and feel that you can do the exercises on your own, as long as you do the exercises on your own, I think that that's fine as well. And then once you reach about the 4-week point, you can tell the patients that they can start weaning themselves back into activities as tolerated. And I always tell my patients, use your symptoms as your guide. Your body will tell you when you're doing too much. If you're doing something that starts giving you a little bit of groin or thigh pain, it's your body telling you to back off on that and kind of slowly more wean back into that, whatever that activity is. And then I think you should use a cane until you're not limping anymore. If you don't use a cane when you're limping, sometimes you kind of teach yourself to limp. And then full recovery to the point where you've gotten full strength and full range of motion back takes approximately 12 weeks. But between the 4 and the 12-week point, you're fairly functional. So once you reach that point of approximately 12 weeks to 3 months after surgery, most people are fully recovered. And then, as I mentioned before, you really have no restrictions at that point, except you should avoid repetitive high-impact activities. And at that point, you should just enjoy your life, enjoy your hip replacement. So then, for aftercare going forward for the entire time that you have a hip replacement in, there are still things you need to do for maintenance treatments. A common one that's a little bit controversial at this time is what to do with dental work. In the past, it's always been accepted that you needed to prophylax with antibiotics prior to any dental work because bacteria from your mouth during a dental procedure can spread through your bloodstream to your hip replacement. So now that's becoming more controversial. I would say most people now would say that you need to treat with prophylactic antibiotics 1 hour before any dental work, including cleanings, for at least 2 years after surgery. And then after that, it kind of depends on what your surgeon preference is. Some surgeons will say you should do it the rest of your life. Other surgeons will say there's really no data to suggest that the risk continues after 2 years, and will say you don't have to do it after 2 years. But it's essentially surgeon specific. You also have to consider taking antibiotics prior to any other invasive procedures. I think common procedures in this category are biopsies of something, colonoscopies. And if you're not sure, just ask your surgeon. But same thing with these procedures. If you get some of these invasive procedures, especially if the procedures are being done where there's a fair amount of bacteria from that location can spread to your hip replacement through the bloodstream, and so you just have to take that 1 dose of prophylactic antibiotics prior to the procedure. The other thing is that we see probably a little more common than we'd like is that essentially just because you get through the surgery without an infection, some patients feel that they're home free. There's no way to get an infection afterwards. But there are definitely some individuals that at any point after the surgery, whether it's a year, 3 years, 5 years, 10 years, can get an infection in their hip replacement that spreads from an infection someplace else in their body. And it's always a bacterial infection, not a viral infection. So anytime you get a bacterial infection when you have a hip replacement in, you need to get put on an antibiotic right away. You can't let it linger. You can't let the bacteria have time to spread through your bloodstream to get to your hip replacement, because once that happens, antibiotics no longer help it, and you require surgery at that point. So then also you need routine follow-up, and this is also somewhat surgeon dependent. So as you can see in this x-ray with the arrows, you can see how the metal ball of the hip replacement doesn't sit specifically in the center of the cup, which means that the ball has ridden up into the plastic, so it's worn through some of the plastic. And then when that happens, it creates bone damage. As you can see, the yellow arrow pointing to some bone damage that's occurred behind the acetabular components. And it's that bone damage that can loosen implants with time. So technology has gotten a lot better, and this does not happen as quickly as it used to, but most surgeons would recommend that you have a follow-up x-ray at a certain interval afterwards just to check to see if this is happening in your case. Most of us like to see you and get an x-ray about 1 year after your surgery. If that x-ray looks good, most surgeons usually will have you come in anywhere from 3 to 5 years after that to get periodic x-rays to see if this is happening. And the reason for this is that if you notice when you're starting to wear through the plastic or starting to get bone damage that could jeopardize your implants and could loosen them eventually, if you get to this sooner, as you see on the right-hand side there, this is the same patient that had a relatively minor operation to go in and take the old plastic out and then pop a new one back in, and then the metal implants are all the same. And then that stops that plastic wear and the progressive bone damage, and you can end up having a much less involved surgery than if you waited till it actually loosened the implants. So it's definitely important to get routine follow-up after your surgery. So another common question we get is, how long will my hip replacement last? As I mentioned before, it essentially depends on what you do to it. Every patient is different. But realize that technology has gotten a lot better with time, so they do seem to definitely last longer now than they even did, 7 or 8 years ago. And I tell my patients that as long as the x-ray at the 1-year point looks good with no issues, there's a very good chance that you probably will get at least 20 to 25 years out of it. But again, everyone's different. So I thank you for the opportunity to answer a lot of these common questions after hip replacements.